Stephen Christian Michaels was named President and CEO of Family Services of Western Pennsylvania in July 2014. A veteran of Human Services and formerly Family Services Chief Operating Officer, Stephen's impact can be seen in the agency, our region, and the practices of human services organizations nationwide. He has a clear vision for the future of family services. He has spent his life focused on the best practices of delivering effective human services.
At Carnegie Mellon University, I chose a major of psychology. I volunteered for the Peer Help Center, where I learned the Carl Rogers model of non-directive counseling, working with college students who were abusing drugs, depressed, and even suicidal. I had a student call me at 2 a.m. when I was on duty, and he was an architecture student who was overwhelmed with his studies, depressed, and suicidal. A year later, he called me and said I had been very helpful to him. He graduated with a degree in architecture, and at that point, I knew my course. At both Carnegie Mellon and at the University of Chicago, I developed teacher evaluation programs. In my first 2 jobs, I helped expand agencies to move from individual to family therapy. Soon I was promoted to start case management services, in-home therapy programs, and I also developed a statewide association to support new in-home service programs. I became the president of the Conference of Allegheny Providers and the president of the Pennsylvania Community Providers Association. These opportunities in my career have helped me to become an advocate and a change agent at the organizational, county, and state level. As a helping professional, it is easy to be focused on the individual's issues. That is critical. But I've always tried to stay focused on developing processes and systems that will help more people as they impact institutions and ultimately individuals. There are so many unique and special things about family services. We have a history of providing integrated care with behavioral health services in primary care locations. Now we get to do the reverse, primary care in our behavioral health services locations. Another innovation, in 2001, we engaged Boston University to help develop the Psychiatric Rehabilitation Program. Family Services was one of the 6 agencies in the Recovery Centers of Excellence. We were one of the first agencies to implement peer specialist services, where people with a lived experience of mental illness are trained to help their peers with funding from Medicaid. We leveraged funding from the Housing and Urban Development, HUD, to build 11 very attractive and fully ADA group homes. And we have ongoing funding for 30 years to maintain the homes. Family Services is very technology oriented. We were one of the first agencies to adopt a web-based electronic health record, the first to use key performance indicators and dashboards, and the use of tablets and GPS devices for mobile staff. Family Services is often in a leadership role of regional and statewide transformation efforts. We have been central in the deregulation of drug and alcohol services, redesign of case management, and promotion of integration of care and health homes. We have agency directors chairing critical statewide committees, task force, and providing the role of the president in state and local associations. Our policies and procedures are freely shared with our national association and used by many agencies across the country. The agency is consistently sought after to be part of the solution, planning new ways to deliver care and advocate for legislative or regulatory changes. There are many changes coming to human services due to public policy and funding methods. Healthcare reform is creating accountable care organizations, or ACOs. There is a movement to performance-based contracts away from volume-based fee-for-service contracts. You will see more provision of services to middle-class older adults, allowing them to stay in their homes. Employment programs that help people obtain jobs, avoiding the need to depend on disability insurance. And lastly, the encouragement and expansion of second careers for older adults who may not have a pension. Family Services is well positioned to continue to grow, partner, and innovate. Some of our key initiatives are to improve the quality of services through staff training, recruitment, and consultation, to increase diversity of services, adding child welfare, expanding older adults and employment services, to be the preferred employer with improved staff retention, and to further increase our work with other agencies and organizations, including adding new partners, providing administrative services, and considering mergers. We are looking to increase the visibility of Family Services. Most people don't know about Family Services or the excellent services we provide. Of course, we're always looking to grow our individual and corporate donations, making it possible to start new programs. We have a goal to expand the number of group homes, perhaps through acquiring some small providers. We will also expand our children's services with a focus on autism or child welfare. And the final area, an expansion of employment services in mental health, intellectual disabilities, and older adults.